perform hand hygiene and introduce yourself. My name is Kylie. I'll be your nurse today. Can you tell me your name and date of birth, please?
My name is Braden. I was born 1/22/99.
Okay, thank you, Braden. What are you here for today?
Just a normal checkup.
Okay, thank you. Do you know what day of the week it is?
It's Thursday.
Okay, my patient is alert and orientated ×4. Braden, can you tell me your height and weight?
It's about 5'7", 180.
Okay, the patient seems to be appropriate height and weight for his stated age. His nutritional status looks good. His hygiene is good. He's groomed and well kept. He's dressed appropriate for the season. His posture is comfortable and erect. His facial expressions are symmetrical. This is where you would perform vital signs to have a baseline: blood pressure, temperature, pulse ox, heart rate, and then after you have that, you'll start with your head to toe assessment. You'll start with the head. You're going to check the head hair distribution is normal. There's no lice or anything wrong with his hair. You'll check his face. His face is symmetric and warm to touch. His head is normocephalic. Okay, Brady, we're going to move to your eyes. I'm going to look at your pupils. Pupils are round and equal. We're going to check for light response. Okay, pupils respond to light. Now we're going to check accommodation, so just follow my pen. Okay, and now you're going to follow it here. Okay, his eyes accommodate, correct. So now we're going to check your eyes. Okay. There is no obvious inflammation or redness. His conjunctiva is pink and his sclera is white, so that is normal. Now we're going to move to your ears. Okay, any pain or discomfort?
No.
No signs of discharge. His skin is intact and warm to touch. Okay, now we're going to check your nose, so you'll just look up for me. Okay. His nose is symmetric, no signs of nasal discharge. Okay, Brady, now we're going to check your mouth, so say all for me. Thank you. His uvula is midline and +2. His mouth is pink and moist. And now we're going to check your sinuses, any pain or discomfort. Okay, perfect. His head is done. Now we're going to move down to the neck. Right now I'm going to check your carotid arteries, first by palpation. Okay, good. Now we're going to also listen for bruits. All right. And you'll use the bell of your stethoscope on this. Okay, no signs of bruits. Now we're going to check for JVD. Braden, can you turn your head to the side? Okay, no signs here. No sign of JVD here. Now I'm going to just feel for your lymph nodes to make sure that there's no swollen or hard lymph nodes. Any pain or discomfort?
No.
Okay, perfect. Now I'm going to check your skin turgor. Okay, skin turgor is normal, no signs of dehydration. Okay, Brady, now we're going to check your lung sounds. First, I'm just going to watch your breathing to make sure that you don't use any accessory muscles. Just breathe normal. Okay, thank you. His breathing looks normal, no use of accessory muscles. So now we're going to listen. Each time I move the stethoscope, just deep breath in and deep breath out.
Okay.
Good. Perfect. Now we're going to check your back.
Okay.
Perfect. So respiratory sounds are normal, equal, unlabored, anterior and posterior. They sound normal. Now we're going to listen to your heart sounds. Okay, first we're going to check the aortic, then the pulmonary, then the tricuspid, and the mitral. Okay, sounds good. Then we'll check S2 and S1. Heart sounds are normal, heart rate and rhythm is normal, no signs of extra heart sounds or murmurs. S1 and S2 sound normal. So now we're going to check your apical pulse for 1 minute. Thank you. Okay, sounds good. Now we're going to move down to your abdomen, so if you want to lay down and get comfortable. First, we're going to check the contour of the stomach, which is flat. His umbilicus is midline, no signs of scars, bumps, bruises, or lesions. And then we'll listen to the bowel sounds in all 4 quadrants for 1 minute. And if we don't hear bowel sounds, then you would listen for 5. Okay. His bowels are active and in normal range. We're going to check the abdominal aorta to assess for any bruits or signs of aneurysms before we palpate the stomach. Okay, so no signs of bruise or aneurysm, so now we can move to palpation. You'll start with a light palpation and move to a deeper palpation to check for pain and tenderness. Okay, Braden, I'm going to just feel your stomach. Tell me if there's any pain or discomfort. Okay, and you do a deeper palpation. All right, thank you, Braden. Okay, so the abdomen is normal. There's no signs of pain or discomfort, no grimacing of the face. So now we're going to move to your extremities. We'll start with your upper extremities and move to your lower. So first I'm just going to assess the skin for any lesions, bumps, bruises. It's warm to touch. Okay, perfect. Thank you. We'll check for edema on the skin. No edema noted. No edema noted here. We'll check the radial pulses. You want to check at the same time so you can make sure that they're the same. +2 bilateral in the radial pulse. And then we'll go to the brachial pulse, which is also +2 bilateral, so that's normal. We're going to check your cap refill. Okay, cap refill is less than 3 seconds. All right, so now we'll move down to the lower extremities. You're going to also check for edema in the legs. No edema noted. Skin is intact. No obvious signs of lesions, bumps, or bruises. You would check the cap refill on the toenail as well, and then the pedal pulse. Okay, +2 bilateral. So that's good. Okay, Braden, if you'd like to sit up, you can. We're going to check for strength in your extremity. So if you want to put your hands up like this, push towards me, push towards you. Okay, then push in, then push out. Okay, now we're going to check your legs. Push out, then push in. Okay, push down on my hands, push up. Perfect. Strength in all extremities are normal. If you'd like to stand up, we're going to check your range of motion. So if you'll just do this with your arms. Okay. And then up other way, range of motion in upper extremities is normal. Now your legs, if you can lift each leg for me. Perfect. So range of motion in all 4 extremities. Now I'm going to have you walk so I can check your gait and your posture. Just walk straight for me. Perfect. Now go back. Okay. Gait and posture is correct and straight. Okay, Braden, you can have a seat. Okay, now that our patient's head-to-toe assessment is done, we're going to leave the patient in the room on the lowest possible bed. The bed rails will be up for safety. The call-out will be in reach. The IV tubings will be out of place where you can't tangle them up. We'll check the IV site to make sure that that's fine. Make sure he doesn't need anything else, and then that's the end of our head-to-toe.